In February 2014, we launched the PINSAP, the Interdepartmental Plan of Public Health of the Generalitat of Catalonia, an initiative aligned with the World Health Organization recommendations to promote health from all areas of action by government and society. After a year, there have been actions put in place to cope with the 5 key challenges to public health at present. The first challenge is to control the excess weight among the population and decrease the incidence of chronic health problems. For this reason, we are promoting consumption of fruit with each meal. 1 out of every 3 people eat out more than once a week, and only 12% of the population eat 5 pieces of fruit or fresh vegetables as recommended. The project right here, Fruit and Health, is already a reality, with the complicity of the commercial sector. It is a promotional and identification campaign of businesses engaged in providing appetizing fresh fruit ready to eat. Up to now, it has been deployed in restaurants of Lleida, where the pilot test took place, and on Terres de l'Ebre also. We are now spreading to the rest of the territory. The second challenge is to prevent and control infections. In the past 20 years, we have avoided more than 900,000 cases of disease, according to the latest report on public health policies. Our investment in vaccines stand for 1/3 of the public health budget. In Catalonia, more than 3 million doses are provided every year to more than 1.5 million people. In 2014, we have developed and implemented a new vaccination schedule that includes, for the first time, vaccination against hepatitis A in children and against whooping cough in pregnant women. This has made possible a reduction of more than 25% of cases of whooping cough in infants in the first year of life. For years, we've been working in a coordinated way with the organizations and the healthcare system on HIV and other sexually transmitted diseases prevention and control programs. We have extended the rapid HIV test to pharmacies and primary care. In 2014, we had to cope with significant outbreaks of infectious diseases, and so we acted proactively in cooperation with healthcare to rule out more than 90 suspected cases of because we know infections have no boundaries. The third challenge is the promotion of mental health. Social prescription promotes the use of community resources, mainly municipal, to improve mental health. We aim to have an impact, especially on those who live alone. The fourth challenge is to control addictions. The Fit Jove project, which has been launched in several municipalities, promotes, in coordination with the municipal councils, sport practice to prevent addictions among the young people at risk. From 2011 to 2013, we have helped 200,000 people over the age of 15 to quit smoking. And in the past 10 years, the Class Free of Smoke program has helped to reduce by half the students who smoke. Our vision, contrary to the use of electronic cigarettes in public spaces, has been pioneering, setting up criterion. We've issued recommendations, organized talks, and done consumption monitoring in accordance with the guidelines of our advisory council. The aim of these actions is, on the one hand, to inform the people who smoke electronic tobacco that, in fact, they're smoking, and in the other, to cease the rise of consumption of this tobacco. The fifth challenge is to involve the entire country in the overall construction of our health. This is why PINSAP has been set out in several fields. Territorial PINSAP conferences carried out in all health regions made clear the active participation of ministries, local governments, institutions, and the health system in displaying the plan of objectives and the willingness to cooperate even more. Together with the Institution for Catalan Literature and the network of Catalan health promoters hospitals, we created the lectures Letters and Health, an initiative with sessions throughout Catalonia. In regard to occupational health, we are working on the definition and recognition of health promoter companies. On community health, we are strengthening the role of primary care and public health in collaboration with the pharmacy offices, the local administration, and the third sector organizations. And by a government agreement, we have created the health test, a method to assess the impact on people's health from policies and plans of the different ministries, as the mobility plan, or the Senior Safety Plan. Our goal is to maximize the positive effect on health of every action carried out. The PINSAP gets central and local governments, institutions, and civil society involved in a state of cooperation with a common goal to improve the life expectancy in good health for the entire population, being open to every initiative that adds up efforts and complicities to improve our health.